My next guest is lucky to be here. In fact, Mark Pritchard is lucky to be anywhere, really. At the comparatively young age, well, in his 50s, he had a brain hemorrhage. He underwent surgery while he was wide awake and has written an extraordinary book about this story. He's here now. Welcome, first of all. Let's just talk about your life before the brain hemorrhage, in terms of lifestyle and health and work. You were a sort of pretty active, fit guy.
Well, I've always had a bit of a Superman mentality. I've always thought that nothing would ever get me, nothing would ever defeat me.
Standard male behaviour.
Well, yeah,
live forever.
Well, I think perhaps because none of us can envisage what it's like not being here. Perhaps we all have that to some extent. But I mean, if you were to say to me, don't come close to me. I've got a cold. I don't want you to catch it. I'd say I won't catch it. I've got the world's best immune system. I'm never ill, which is the title of the book, of course. But of course, when I was ill, I did it in a spectacular fashion.
You certainly did. I mean, what do you remember of the brain hemorrhage? Talk me through that moment, those moments before and after.
A lot of the actual moments are quite vague. I know I was pottering around in the lounge in the early hours of the morning just before going to bed. And I had this I wouldn't call it immense pain, but it was a very intense pressure inside my head, over the top of the head. I knew that it wasn't just your normal kind of headache, but I also thought, well, I'm never ill, it'll probably go away. But after, I don't know, my concept of the passage of time is sort of distorted, but probably after about 15 minutes I thought I'd better phone for an ambulance, so I did that. And the ambulance probably turned up about 20 minutes or so later. I even walked down, because I lived in a first floor flat. Yeah, I walked down the stairs, and people were always amazed that I actually managed to do that. But I mean, it was a small brain hemorrhage, so that was what enabled me to still be able to function at that time. So they took me to the hospital, and later the following morning they did scans, and they told me that I'd had this small brain hemorrhage. There's no emergency at this moment in time. I was at the Royal Grant Hospital now in Newport. They said when there's a bed at the Heath Hospital in Cardiff, we'll take you there. But there was a complication. What actually happened, the small amount of blood that came out, basically a brain hemorrhage is a bleed on the brain. The small amount of blood that came out clotted and blocked the channel where there's fluid that's inside your head that it also goes down to the spine, and it drains into the spine. And it blocked the channel where the fluid drains. And this caused a build-up of pressure inside my head called hydrocephalus, and which creates a pressure then on the brain, and then ultimately it damages the brain. And that sent me into a coma while I was at the Royal Grant Hospital.
And at this point, this becomes so much more serious. But clearly, along these moments, you are lucid enough to realise how ill you are. And you're almost registering and starting to write this book in your mind.
Yeah, because what actually happened while this fluid was building up, I was gradually slipping into a coma. And the bizarre thing is I was never aware at any point of any slipping away. I felt at the time that I had all my normal brain faculties, but then I started to talk nonsense, apparently. But I don't remember. People always tell me I talk nonsense anyway, but people started to become aware that, perhaps something was wrong.
We then fast forward to what I found was the most disturbing part of this book. You're on a bed in an operating theatre with your skull cut open, and you're having brain surgery while awake.
Now, I do need to correct you on this. I didn't actually have the craniotomy. That's where they cut the skull. They did the operation through the catheter, through the groin. There's an artery, the femoral artery, I'm not quite sure how to pronounce it, and the surgery was done through that, so there were no incisions. The only incision that was made in my head was when they first got me to the Heath Hospital. They drilled a hole to release the fluid, so that hole is still there.
But your surgeon is talking to you while operating
Yes.
on your brain.
Yes. What they needed to do was to block off the blood supply to it was an aneurysm, a very small aneurysm, which is a weakness in a blood vessel, and they needed to block off the blood supply to that aneurysm. It was too small an aneurysm to repair. So all they could do was to block it off. And the first attempt, because there were two attempts, the first one didn't work, was to push a balloon up through the catheter and into the carotid artery, which is in the head, close to where the aneurysm was, and to block off the blood supply to the damaged blood vessel. Because everybody's vascular system is different, everybody's blood vessels in their head are plumbed differently. They didn't know at the time whether or not the blood was going to flow to all the parts it needed to flow to. So they had to do what they called a blood flow test, and I had to be awake because they would need to ask me whether I could move my arms, my legs, and whether I could talk.
So you're fully conscious at this time?
Yeah.
And what are you thinking when...
Well, it's a long time ago now. I remember more the fear and the anxiety going in. When I was in there, I don't know. I mean, there was kind of a bit of fascination because I could see what was going on. I couldn't feel anything other than the incision in the groin. I didn't even feel the catheter go up.
Could you watch it on the telly? Because they often have those big monitors, don't
Yeah, I could see it to some extent, but I was at a little bit of an angle, so I couldn't see everything.
Would you have wanted to see it?
It wouldn't have bothered me.
Wow.
But I do need to kind of explain why this particular operation went wrong.
You then go from this very dependent patient into some sort of role reversal almost. Your health, you make this miraculous recovery. You look in extraordinary form.
Yeah.
Now I can see that little dent on your head. With
Can you?
Yeah.
Okay. I'll have to
Keep
grow
on
my
combing
hair a
over.
bit.
You'll be all right. And then your other half becomes ill herself after caring for you for so long.
Yeah.
And you take on the role of a nurse just
Yeah.
when you think that it wouldn't be possible
Yeah.
to have any more bad luck.
Yeah. Well, I mean, what actually happened a few years later, I started writing a book about my experiences, but 6 months into writing the book, Sarah was diagnosed with breast cancer. So, as you say, roles were reversed, and she had there was a lump in her left breast, and that was removed. They found a microscopic trace of cancer in one of the lymph nodes, the sentinel lymph node, which is the one closest to the breast. The fact that it was just a small trace in that lymph node suggested that it probably hadn't gone any further, but as a precaution they also removed all of the lymph nodes. Then we had the 4 months of chemotherapy, and then we had the radiotherapy.
I'm just interested to know, in terms of your experience, was there anything you could have done in your health, I don't know, in your diet, in your lifestyle, that could have prevented your brain hemorrhage?
I have no idea. I actually don't know that. All I know now is that I don't have any more aneurysms. So I'm... In the knowledge that I don't have any aneurysms, I'm least likely, in the people in this studio now, to have a brain hemorrhage than anyone else.
So before that night, when you had that incredible pressure in your head, no symptoms at all?
Nothing.
Nothing to suggest that was on its way?
Nothing at all. Bang.
I wonder what you've learnt about yourself.
Our illnesses have had a huge positive impact on our lives. To start with, I can't have a midlife crisis, because at the time when most people would have a midlife crisis, that was when the brain hemorrhage struck. So I see myself now as being on life take 2. So let's suppose, for example, I were to get some midlife crisis, it would have to be in the middle of life take 2, so I might be kind of the age of 86. And I might think, I've only got another 20 or 30 years to go, I better go and get that Harley Davidson.
There's lots of time to get a Harley Davidson. The book is a treat. It's called I'm Never Ill, and it's written by Mark D. Pritchard, and you can find it on Amazon. We wish you every success.
Thank you very much,
Good health. Thank you very much for coming in.
This city